Force. Nigerians watching us from home and from your offices, gentlemen of the press, a very good evening to you and welcome to the national briefing holding today, Tuesday, 29th September 2020. We apologize that we could not come to you yesterday due to other exigencies, which the chairman will explain when he comes to the podium. Today is a very special day, and it precedes our 60th independence anniversary, and it's beautiful. So today we'll be taking the chairman's remarks. We'll take updates from we'll take the technical updates, and if there are other updates from the ministers, we'll bring them to the podium to speak with us before we take on your questions and answer. So let me invite the chairman at this point to the podium for his remarks. Mr. Chairman, sir.
Distinguished ladies and gentlemen of the press, let me start by apologizing for the late commencement of this briefing. The PTF meeting started quite late too because of other conflicting engagements for the day, and to further apologize for our inability to brief the nation yesterday. We came out of the negotiations with Labour extremely late, and that took a toll on invariably most of the ministers that participated. And we couldn't quite sort ourselves out. But we are glad that at least the strike action has been suspended, and that has allowed even those of you that are sitting here to be able to come to work. And we wish to express the gratitude of the government and the people of Nigeria to the leadership of the organized labor, the NLC, and the TUC for the high level of patriotism exhibited in the course of the negotiations and eventual resolutions of the matters that necessitated the industrial action that was declared. We will continue with the pursuit of the negotiations and make sure that all the issues that have been identified and the things that need to be done are done within the given 2 weeks, so that the committee will report back to the negotiating parties for final determination with respect to exactly the rise in the electricity tariff. That is the issue that is contentious, but we believe that it will be resolved. However, I welcome you all to the national briefing by the Presidential Task Force for COVID-19 for Tuesday, 29th September 2020. Let me first apologize to all Nigerians, and in particular our media partners, over our inability to update you for 2 consecutive briefing days. Like I said, this was due to other exigencies associated with governance and activities lined up for the 60th independence anniversary of our great nation, Nigeria. As you are already aware, Nigeria is celebrating the 60th anniversary of our independence, and the PTF has already announced to you all that testing will be ramped up through the National Week of Testing. I urge everyone to brace up for the program and mobilize members of the community as well. Testing is the only way to detect, isolate, trace, and treat. The Nigeria Center for Disease Control has already issued an advisory on the consequences of not testing enough. The numbers are dropping when we compare on month-to-month basis, but we will still have to be vigilant. Health is a shared responsibility on the concurrent list, and as partners in the fight against COVID-19, we urge subnational entities to tread on the side of caution by increasing the rate of testing in their jurisdictions. We desire the support of institutions, particularly religious, socio-cultural, traditional, etc., to insist on in-depth engagement at community levels, especially in observing the protocols. Developments with testing around the world have been very encouraging as technology improves. We are pleased to receive the news of the partnership driven by the WHO to roll out 120 million effective rapid test tools capable of providing reliable results in 30 minutes rather than hours. It will help to reach distant communities where laboratories are not located, and will help in cutting down the response time that medical personnel need to commence treatment. Nigeria continues to partner with the WHO and shall certainly be part of the early beneficiaries of the rollout when it commences. Nigeria is also contributing to the global effort in the diagnosis of COVID-19 through our research institutes, led by the Nigeria Institute for Medical Research. The PTF will be updating you as we make progress in this particular discovery. We note with sadness that the global community just crossed an unenviable milestone when COVID-19-related fatalities surpassed the 1 million mark. It has taken only 8 months for over 33 million persons to be infected and 1 million fatalities to be recorded in almost all countries and territories of the world. These numbers underscore the seriousness of the pandemic and should help to determine how not to lower our guards. Before I round up, let me remind all Nigerians that like our Diamond Anniversary celebration, the COVID-19 has made year 2020 a most significant year for us in Nigeria. We need to do all we can to survive it, and we have the solutions in our hands. And the solutions are simple. The non-pharmaceutical interventions that have been put in place, wearing of masks in open spaces, maintaining social distancing, take heed to personal hygiene and the use of hand sanitizers, and if need be, avoid large gatherings. That behoves on us, that each and every one of us must take responsibility. I now call on the Honorable Minister of State Health and the DG, Nigerian Center for Disease Control, and the National Coordinator to provide us with updates. I thank you for your kind attention and have a very pleasant evening. Thank you.
Gentlemen, a total of 58,460 confirmed cases have been recorded as of today, 29th day of September 2020, with 49,895 cases treated and discharged. This result is from a total of 509,555 persons tested for COVID-19. Sadly, the number of deaths arising from the disease now stands at 1,111 from the 36 states and the Federal Capital Territory. We currently have 7,454 active cases which are being managed at home or in treatment centers, with about half of them in Lagos State alone. The number of active cases has continued to drop, consistent with the general trend in Africa. We will continue to revise our discharge criteria in line with new knowledge of the disease, even as we continue to strengthen our case management pillar to provide effective and efficient quality care to all those who test positive, whether they're in our facilities or in home care. As business and schools begin to open, and as travels begin to pick up, we fear that we may have a surge in the number of cases unless we scale up surveillance and review our response plan to integrate new ways to deal with the disease. In line with this, the Nigeria Institute of Medical Research has developed a molecular test for COVID-19 that can give results in less than 40 minutes. It is the SARS-CoV-2 isothermal molecular assay, SIMA, which can be performed by low-skilled personnel with minimum training. The rollout will be very soon, as announced by the chairman of the PTF. This test, which is 10 times cheaper than the PCR, can be deployed for point-of-care detection and surveillance. The technique, which was developed by Dr. Chika Nwama, will be deployed for use as soon as it is validated by the relevant agencies of the ministry for specificity and sensitivity. I commend the management of Nigeria Institute of Medical Research, led by Professor Salako, and particularly Dr. Nwama, for this laudable breakthrough. I also extend the appreciation of the federal government to the Faith Philanthropy Coalition for COVID-19 Support Fund for funding the project. And particularly, I thank the chairman of that coalition in the person of Fola Adiola. Government will continue to support every genuine initiative that contributes to our response plan. On Friday, 25th September 2020, we had the privilege of performing the commissioning and handing over of the Infectious Disease Center at the University of Abuja Teaching Hospital, which is purpose-built infectious disease treatment center as part of the commitment of the federal government to providing the necessary infrastructure and resources for infectious disease management. It will go a long way towards improving our capacity to respond to all infectious diseases. It is a fallback facility which we do not have to put to use if we observe all necessary preventive measures, such as wearing face masks, observing respiratory hygiene, and physical distancing. In addition, we also need to ensure that we test and isolate all those with symptoms that suggest COVID-19. This morning, the top management committee of the Federal Ministry of Health played host to the Victims Support Fund, who are the ministry to officially present some IT equipment to the Federal Ministry of Health to boost technical capacity of personnel to support our response to the pandemic. The Victim Support Fund has been supporting the Ministerial Expert Advisory Committee on COVID-19. We wish to use this opportunity to thank General T.Y. Danjuma and the management of the Victims Support Fund for the initiative. We recall that the fund has also supported the NCDC as well. We shall again renew our appeal to the state governments to continue to ensure that we step up case findings, sample collection and testing. It is only by testing that we can identify those with infection for isolation and treatment. This is the only way we can truly halt the spread of the disease and confirm that we have actually contained the pandemic. Our goal is to have at least one standard infectious disease center in every state. We shall therefore work with the states to establish purpose-built treatment centers that will ensure we are better prepared for infectious disease outbreaks in the country. I thank you for your kind attention.
And Chair of the Presidential Task Force, Honorable Ministers of Health, Directors, colleagues, gentlemen of the press. Our social media platforms have been abuzz with issues related to the Nigeria International Travel Platform. So I decided to use this opportunity to address some of these issues. But I think the first thing we need to do is to cast our minds back to March 2020, early this year, when we were faced with a situation where people coming back from Nigeria through our airports were seeding infections into our country. And there was a clamor from Nigerians to shut the airports as quickly as possible. This was a very difficult decision for our country, for Mr. President, for the aviation industry. But we made this important decision. And it turns out that that decision, actually, to shut down our airports at that point, must have really prevented a large number of infections coming into Nigeria. And the number of seedings of people were limited to those that came through in those early months of the year when we were not sure of what was going on. So by carrying out decisive action under the instructions of Mr. President, we were indeed able to protect Nigeria from a much worse outbreak than it would otherwise have experienced. Fast forward to September this year. We're again faced with a situation where we had limited the number of infections, but the economy of our country was now suffering. And we really had to make that hard decision. And then lots of people also predicted that the reopening of our airports would lead to a spike of infections, that we would be back to where we were 6 months ago, and that we would experience an upsurge of infections. But because of the very diligent work of my colleagues, especially the aviation industry, we've had a very deliberate, very careful, very calibrated reopening of our airports. And anyone that would have gone through those airports, local or international, will attest to the fact that actually the aviation industry again has challenged conventional wisdom that we are unable to do anything properly in our country. And again, we may have dodged the second bullet, because again, we have not seen the upsurge of infections that people have predicted would happen. So why am I saying this? In all these decisions, platform, no platform, our primary objective is to prevent deaths from these infections, from COVID-19. So on a day where we mark, like the chair has said, 1 million deaths worldwide, I really urge all Nigerians to keep our eyes on the ball. Let's keep our eyes on the ball, on what we really want to achieve. Are we not able and willing to accept a little bit of inconvenience for the goals that we're trying to achieve of saving lives? A friend, Victor, called me yesterday. His wife, his mother was on the way back from the US. And he wanted my number to give to the mom, and was very afraid because his mother had watched a certain WhatsApp video that was circulating. And he wanted some assurance that his elderly mother will manage this system. I told Victor to trust the system, because I know from the data that we're collecting that for 95% of people using the portal is working. There's no single IT system rolled out in the world without some teething problems. And yes, for certain individuals, there may have been some issues which we're trying to resolve. But by and large, people have been using this portal fairly successfully without any hassle. So from the questions we're being asked, I put together 5 of the most important questions I think you'll be asking during your question and answer session, gentlemen of the press, so that we can get over them before you even come out. So the very first one is, why do we even need a PCR test? People are asking. Every Nigerian has a right to come into the country, and we shouldn't be preventing people coming in without a PCR test. I say yes. Every Nigerian has a right to come in, but you don't have a right to infect other Nigerians. So we've put a little bit of a preventive measure, similar as many other countries in the world, to enable us protect ourselves, because we know we don't have a stronger health system as you may have in the countries that you're living in. So please bear with us. It's a small price to pay for the future and the health of our country and its people. And we encourage you to keep trying. A pre-departure test is more or less a standard by most countries in the world now. The second one is if we do a pre-departure test, why is a post-arrival test necessary? There are 2 reasons. You have 2 separate opportunities for infection after your pre-departure test. One is in the 5 days prior to travel. And you know, initially we limited this to 72 hours, 3 days, we moved it to 96, and now we've moved it to 5 days. Because we recognize that many Nigerians were complaining, and sometimes they have to go on adjoining flights before getting to the airport of departure, and therefore it becomes a bit tricky. Many other countries have limited it to, in fact, I just saw an announcement by the United Arab Emirates announcing that they too will require a pre-departure test, but 96 hours before departure. So by our allowing 5 days, we're fairly generous. But that means that there is an opportunity for infection, both before travel and during travel. And we've actually seen that a fair number, I think about 5% of returning travelers in Abuja actually were infected at the point of arrival. So this justifies our work. And in a couple of studies just published, one in Vietnam and one in Hong Kong, both of which have demonstrated transmission during flights. The study out of Vietnam showed that in a flight of 217 passengers, 16 people were infected during that flight. So it is very important that we test on arrival, and we're trying to make this easier for people to do. Then the third question that has come up a lot is, why are people asked to pay for the privately for the test on arrival? You see, we have made a commitment as a government to make sure public sector testing is free for everyone throughout this outbreak. Most public health tests in Nigeria previously, whether it's been Lassa, yellow fever, monkeypox, whatever we've been testing for, where there's a threat to the public, the test has always been free. And so the government of Nigeria has worked very hard to ensure that our public sector testing is free. But the test in itself is not free. Remember, somebody's paying. Somebody is always paying. So the government of Nigeria has made a decision to prioritize the public and to make sure that we enable this test to be available for everyone that needs it in the public sector. We cannot compromise that for people traveling. Travel is a choice. So if you do want to travel, you have to pay for that test on arrival. And none of those funds, not a single dime comes to NCDC or any federal government parastatal, ministry, agency, or the PTF. This goes directly to funding the test itself in each state, with a small percentage going to the state government negotiated for overheads. So none of this comes to NCDC. We're not making any money out of it. We never will do that. The fourth question is, why do we even need a tribal portal? Why can we just not come back and, just like the yellow card system, you come back and you find your way through it? This is a unique situation. We have to manage our situation better. Our colleagues in the aviation industry have really worked hard in scheduling the flights, ensuring that there's enough time between each flight. But ultimately, not all the flights are coming in. As soon as we open up more, or they open up the airspace more, there'll be more people coming in. We cannot manage what we don't measure. So we need this information, we need the data to manage, to follow up. What people don't know, anyone that has come back from travel will tell you they receive a call every single day for the 7 days after arrival. We need your details in order to do that. If you're positive, we need to follow up with you and prevent further transmission in your family and in your communities. And finally, one question comes up, is testing all you do? You're always talking about testing. But it's not. Anyone that would have traveled would notice you have to wear a mask throughout the flight. Yes, it's inconvenient, but every airline insists that you do that. You have to stay indoors for 7 days after arrival to prevent transmission to others. You still have to adhere to all the social distancing guidelines and all of that. So all of this is to limit transmission. The earlier we get used to these, the better, because even if there is a vaccine, it will still take us a while to scale up the production capacity for 6 billion people, to distribute it efficiently and effectively across the world. So yes, there'll be teething problems. Everyone is working on this. And I'm sure that in a few weeks, just like everyone has forgotten the challenges with the call center and all the things that used to agitate us, we will get over this small bottleneck. I'll end by saying, when you're practicing as a doctor, you're only primarily concerned about the health of the patient in front of you. And yes, what is the analogy here? If there's one WhatsApp video by one individual circulating, it's okay for people that are in that mode to think that this represents the experience of this individual. It must be very sad. And of course, we will do everything possible to make sure that everybody has a good experience. But when you work in public health, like I do, your goal is to ensure that most of the people have good health. And sometimes it means that not everybody will. So we'll continue working very hard to ensure that most people traveling will have a good experience. Sometimes we're unable to cater for every single thing. We've tried to solve problems on the technical side, and the NC will share a little bit on the hard work we've been doing on that. Public sector, private sector, everyone coming together. But I really want to assure Nigerians, especially those of us in the diaspora, especially my brothers in Sweden, to bear with us. You are important to us, very important. The contributions of the Nigerian diaspora are critical for our country. And as we celebrate Nigeria at 60, don't give up. We'll keep working very hard to prevent an escalation of cases in Nigeria, which is our primary commitment, but also work with every other person in the industry to make sure travel home is as convenient as possible. Thank you very much.
Honorable Ministers, members of the PTF, gentlemen of the press, good evening. As discussed by the DG NCDC, I will be briefly going through the procedure for travelers returning to Nigeria. It's been approximately 4 weeks since we launched the Nigeria International Travel Portal. Since then, we've had just over 27,000 passengers coming through Lagos and Abuja. 18,000 plus through Lagos, just a little over 9,000 through Abuja. So it's a huge operation. Of the 27,000 plus passengers, 99.8% of them had a negative COVID-19 PCR result. The majority, specifically 85%, had no issues with payment on the portal. Of the 15% that had issues with payment, this was resolved in 12% on arrival. So it is correct to say that of the 27,000 coming into the country, the majority seamlessly went through the registration, the entry, and the retesting process. However, with an operation of this scope and scale, there are bound to be issues that will arise. This is an IT system. It's not perfect. We are humans. Talk less of computers. And especially with a travel portal that is relatively new. We didn't even trial this travel portal. We had to immediately implement it because of the pressure for opening the international airports. Without the travel portal, we probably would still have been struggling to open up the international airports safely. The PTF has been working collaboratively with our public and private sector partners to address the issues and challenges that have arisen as a result of this operation. We are aware of a particular case of a traveler who had been charged multiple times for his PCR test on arrival to Nigeria from Sweden. The online platform failed to record his payment for the retest in Nigeria due to technical difficulties. As soon as the PTF was made aware of this unfortunate experience, we immediately began investigating to resolve the issue. I'm happy to state that the person has been refunded the extra money he paid. In fact, it was repaid on the same day that we got the information that evening. And the process is now being fine-tuned to prevent such occurrences. We do sympathize with the frustration travelers have to go through when the system malfunctions or when they experience these challenges. But throughout the world, nowadays, if you're traveling, you have to fill in additional information on IT systems belonging to countries, and you have to submit them as a prerequisite for traveling. And Nigeria is no different. We really need to move away from paper copies. We need to have electronic systems that would allow us to go back and check when things go wrong, when people have positive COVID-19 results in country, having come in with a negative result, or where they fill in a health questionnaire and we need to review to find out whether did they or did they not have symptoms when they arrived. We cannot continue handling paper copies because it's very difficult based on the number of passengers we have. We get between 5,000 to 7,000 passengers when fully open coming into the country every day. And the amount of paperwork generated is huge. It's impossible to be able to investigate and find out what has gone wrong in the event of importation of COVID infection into Nigeria using the current paperwork format. It will not work. Therefore, we urge returning travelers to please bear with us and do not hesitate to bring your issues directly to us. The PTF is committed to improving the entry process. That is why we are working with our partners, CACOVID, to implement a 24-hour customer service hotline with the NCDC, as well as customer service representatives stationed at the airports. However, in the interim, travelers are requested to please email us on travelportal@ncdc.gov.ng, travelportal@ncdc.gov.ng if they are having issues. We are also asking the public to support us in our efforts to significantly flatten the curve of this virus in our country. One of these measures, which the DG NCDC mentioned, is the need for us to have a repeat test at day 7. The reason being that when you come into the country having had a COVID-19 PCR test that's negative up to 5 days before departing your exit country, and you are tested at the airport, you have a less than 10% chance of being picked up if you are going to seroconvert. And indeed, we have been proven right. Of the 2,403 passengers that were tested in Lagos, when we started this exercise, 80 were positive. And meanwhile, they had negative COVID-19 PCR test. I can assure you, if we had tested them on arrival at the airport, we wouldn't have picked them up. If we had, we probably would have picked just a handful. So, out of 2,400 passengers, you pick 80. If we start running at full blast with 5,000 to 7,000 passengers every day, how many will you be missing if you do not look for it? If we had a system of enforcement of isolation, such that everybody coming into the country self-isolates effectively for 2 weeks, you do not need to do the testing because we know that you will not transmit to anybody else. But we don't have that luxury of checking. Neither do we have the resources to check and enforce this. Therefore, our only option is to pick up people that are likely to become infectious fairly early on, with the best chance, which would have been at around day 7. And that's why we are testing at day 7 after arrival. In terms of resolving technical difficulties, for passengers facing issues with the portal, please visit the frequently asked questions under help and support on the online portal, which is nitp.ncdc.gov.ng/onboarding/help/FAQ. If you are debited for a failed payment or debited more than once, please follow the following steps. Contact your bank providing transaction details, including transaction date, amount, and transaction reference. Your bank will then log a request from the acquiring bank where applicable. I'm sure a lot of us would have been debited more than once, and we do have a process that allows us to reclaim our money. This is not going to be any different for passengers. So please, not to panic. If you have not been able to complete the payment online and did not receive a QR or barcode before boarding, you can visit saferports.com/my-traveler-record. So saferports.com/my-traveler-record to retrieve your QR code. Access report instantly. With the QR or barcode, you can generate your QR or barcode without paying. So if you go onto the system, the first step is you fill your health questionnaire. The second step is you upload your COVID-19 PCR result. The last stage is when you pay. After the second stage, you are able to generate a QR code if you are unable to pay for whatever reason. At the moment, we have not made a QR or barcode mandatory, but in the coming weeks, we will, because we need our records to be electronic, just like any other country. So as we wait for the portal to be fully stabilized, we need passengers to go in and fill those details. If they do not fill those details in the coming weeks, they will not be able to board. And this is independent of payment. So we are not punishing Nigerians for not paying, but there will certainly be penalties for not putting your electronic details on the system. So, as a temporary measure, passengers will be required to pay the COVID-19 PCR test on arrival in Nigeria if they are unable to. But it's worth saying that passengers without a QR code at the moment may face longer delays, and indeed are facing longer delays on arrival in Nigeria before exiting the airport. If you must correct information already provided, then please email travelportal@ncdc.gov.ng with the email subject, correction of travel portal. I will briefly mention a few things about private laboratory testing. Please understand that we are asking everyone to conduct 2 PCR tests, as I said, one before departure and another 7 days after arrival. Please note that these tests are being conducted by private labs found on the travel portal. Do not pay laboratories that are not registered in the travel portal. As mentioned before, we have had cases of positives, and this is one of the reasons why we continue to consider the day 7 testing absolutely necessary. The cost of the PCR test has been raised repeatedly. Just to clarify, as mentioned by the DG NCDC, no federal government agency is receiving these funds. The negotiation for the cost is between the state governments, where the private labs are, and the private labs themselves. The charges range between 35,600 for the Kano portal, which we are just about to operationalize, to 50,400 naira for Lagos. We continue to urge private laboratories to fulfill the requirements to get onto the portal, because as we do that, the cost will come down. As we saw with the Abuja portal, the cost has come down from 42,500 to 39,600 or so. And we believe with more laboratories coming onto the portal, we'll be able to push this cost even further down. And in the future, it may be possible to have a more rapid test that is more cost effective. In terms of where you do your test, the portal will be changing. The question will no longer be where are you arriving, whether Abuja or Lagos. It will be where will you be at day 7. And you'll be able to choose based on day 7 your sample collection centers. We are aware that it's impossible to have sample collection centers in every single city in the country, but we are already making significant progress. We've opened a lab in Kano, and we'll be opening a lot of sample collection centers across the country over the next few days, so that it will be easier for passengers. But wherever you are, if you pay for a test on the portal, it's the responsibility of the laboratory that you have paid to make sure your sample is collected. You do not need to come back to Abuja or Lagos for your sample to be collected. If there is no private laboratory in your state of final destination, the laboratory you have chosen for your test during registration will make arrangements to have your sample taken at a designated lab. And we are working very closely with other states to create a mechanism for private testing. We've already approached about 6 or 7 states that already have private labs in their states. But to see a list of accredited private laboratories, especially if you are traveling out of the country, you can visit the NCDC website, the microsite, covid19.ncdc.gov.ng/private labs/. Finally, as is evident in many parts of the world, COVID-19 continues to pose a significant danger and challenge to all of us. And as the world begins to embrace the new normal, following the resumption of travel and the repatriation process, we will continue to address new challenges as they arise. As mentioned by the DG and CDC, there will be some inconvenience. We plead with the public to please understand with us as we continue to make this process more streamlined and easier to navigate. The International Travel Portal for Nigeria is our innovation for controlling the spread of COVID-19. And indeed, as a country in Africa, we are one of the few countries that actually have a functional travel portal. This makes travel possible, and it makes it seamless for the travelers. The task force, CACOVID, and other partners will continue to work relentlessly to ensure that the challenges we are facing are dealt with swiftly. Hopefully, as we open up the customer service support center, it should be easier for passengers to reach out if they are having issues. Some of the issues we have seen on the social media are issues that could have easily been resolved if they had reached out to the right person. So information is obviously key. The PTF appreciates everyone's patience, cooperation, and understanding as we resolve these technical issues and continue to facilitate international air travel safely. I would like to, in particular, thank the Coalition Against COVID for the amount of support they have provided the federal government, the amount of time they have spent with us in the evenings, including chief executives of banks, very busy people working on this travel portal to make sure that the experience of passengers in Nigeria is as comfortable as possible. And finally, on a more personal note, I would like to acknowledge the retirement of the Permanent Secretary, General Services Office, Mr. Olusegun Adekunle, and thank him for supporting the PTF. Thank you for supporting our country at a very difficult time. Thank you.
Today is a special day, so no questions today. Have you changed your mind? You've changed your mind? One question? Okay, we'll indulge you.
Good evening, Chairman and members of the PTF. My name is Mitaire Ikben. I report for the NTA. My question is for the Minister of State Health. With respect to the test which you talked about, we want to know if the test will be using swab or blood samples, and how soon will it be deployed? No, before deployment, you said it will go through a validation process. So how long will that validation process last before deployment? Then for the national coordinator of the PTF, we understand that you said actually before now that children are not expected to pay for the test, but just like other teething problems which you clarified here today at this briefing, we understand that some passengers are still having issues with the port health workers with respect to children paying or not paying for the test. So you may wish to also clarify that. Thank you.
The sample, the usual sample oropharyngeal and nasopharyngeal, that is the nose and the throat. Then how long? Well, you had the chairman say that the rollout will come because, in fact, the kit this is the kit. But there are other things that will still need to accompany this to make it work well, aside the validation from the relevant agencies that we said. Well, I think that's just a matter of time, but I can assure you that the process is on. But at least let it be on record that Nigeria is not lagging behind in trying to do something regarding research to combat COVID-19. I think, Amaka, what you were asking about insurance, we made it allowances. Yes, okay, the insurance, we did say that for every worker in the federal civil service, you have this insurance scheme that every worker is entitled to, particularly when there is a death. And once it happens, God forbid, to anyone, the next of kin or the family members will activate the process through wherever that person was serving prior to death. So it's domiciled in the office of the head of civil service of Federation. The allowance issue, yes, the initial projection was for 3 months, and unfortunately, because of paucity of fund, the 3 months initial projection could not even be met, but we met up till 2 months fully, then part of the 3rd month. And then we are still looking at getting the funds to pay the subsequent months. That is in progress as we speak. And the understanding is that it's a continuous thing, that is, having committed ourselves to it, and we are in the process of getting that outstanding paid. That is the situation. Thank you.
Thank you, Amaka. I think you are a rapid diagnostic test kit, an antigen test that has just received emergency use licensure. That's what EUL stands for. Yes, we received that. Everyone in the world received that finally last week from WHO, so we're very happy about that. A small group is looking into right now how to implement it in Nigeria, in what circumstances to use it in. It's still not as good as a PCR test, but it's very good. So we have to define in what circumstances we will use that and in what circumstances we will stay with the PCR test. So I think by next week we'll be in a position to say exactly how we'll introduce it into the country. We already started discussions on how to get some into the country to start using. So it does provide a lot of opportunity for the country and for all of us. But just like I say with vaccines, there's no magic bullet with all the tools that we're getting. You know, whatever we have, we add it to the arsenal that we have already. And the response to this outbreak is not about testing, it's not about mass, it's not about social distancing, it's about everything. So the best chance we have is by combining all the tools that we have. And we're very grateful that it looks like we have a new tool in the arsenal. It was at the center of discussions in the PTF meeting just before the press briefing. And we're all looking at how to introduce it into the system from as soon as possible. Thank you.
On the portal. As I said earlier, we'll be introducing a customer service support unit, including increasing the number of people at the airports that will provide additional information to passengers. We'll also be putting up notices in the airports at the arrival halls to specify who should pay, if you haven't paid, what the procedure should be like, and who's excluded. But certainly if there are people with children below the age of 10 that may have inadvertently paid, they should let us know through the email that I've already provided you with, and we'll get back to them. Thank you.
Realize that I had thought that the question relates to national coordination of our efforts. Yes, and but to speak to what it is that the education sector and how it's coordinated nationally. Yes, this is not scattered. The word for the reopening effort is not scattered. It is subnationals responding to the guidelines that we've already issued them. If you remember at the PTF briefing some 2 weeks ago, we gave out the guideline and the template as developed for the entire nation. And we know that all states may not all come on board at the same time. They may not all be ready to. Bayelsa is going to open on the 5th of October. Benue said 21st of. When they are ready, we have quality assurance directors in every state. They are coordinating this effort with the states. For every state that is ready, we will certify them and they will proceed. We do not think that education is, especially at the primary and post-primary level, is something that everybody must stay at one point until everybody is ready. So some people are making the effort. Some have had all the guidelines complied with. Some areas are also a little bit not as ready as others. So we've asked that as soon as you're ready, and some states had already achieved some room in their work plan as the curriculum and syllabus that they had already had to work with ahead of the shutdown. So everybody is responding within the guidelines and the template provided in the manner that the state can cope and run with, especially as it regards to their own readiness. But in addition to all of that, the tertiary institutions, which are coordinated by their different governing bodies, the MBTE has a separate set of guidelines for polytechnics, and they've issued that to all the polytechnics. The NCCE, that coordinates colleges of education, already has these templates gone forward. The Nigerian Universities Commission, that deals with universities, has already sent theirs out. About 93 universities have responded, and those ones will begin their own reopening, because we want to be sure that the templates that on guidelines we sent out to all of these people, they're all in compliance with it. For the teachers and those who provisions that have been made in public institutions and schools around the place, they need that sort of compliance. Some of them will need approval of their councils. Some of them are regulated differently. And some private universities are already ready. Some are already opening in some sort of way. So each of them are autonomous. If you look at the Universities Autonomy Act, or even the Polytechnic, all of them are semi-autonomous. What we do is provide a national coordination around the set of template and guidelines that is available. What we're also doing for teachers, those who are outside the public sector, we've asked them to go to, graciously, this government has provided some window of support, like we said. Yes, we have received a lot of, a deluge of requests, but I still think from the number of teachers we have in Nigeria, because on the 5th of October, when we begin to celebrate World Teachers Day, or when we mark World Teachers Day, I might be asked this question. So I want those who are private school teachers who have not signed on to collect their survival survival, I don't know what to call it, but the federal government has made that provision. But it's on the website of the Ministry of Trade and Industry. The Ministry of Trade and Industry. On the website, it's called www.survivalfund.ng. I repeat, www.survivalfund.ng. The Minister of Trade and Investment, Otumba Adebayo, and the Minister of State for Trade and Investment, Her Excellency Ambassador Miriam, have all made this portal available so that anybody who is any of our teachers nationwide and you're teaching in a private school, our case is that all the public school teachers have been earning their salaries. We don't want to lose our teachers in the private schools because their proprietors were unable to pay them. Because if we lose the teachers, it's the education sector that actually loses. So this is what the federal government has made provision for, so that you all can sign up. Like I said, we have received a lot of applications. We're processing nearly 10,700 teachers, but you need to get on the website to be able to make your provision, wherever the school may be in Nigeria. So we need to have this holistic view about what we are coordinating. So our students, they be rest assured that their states will react, and pressure is on the state governors to be able to react quickly, and as soon as they are ready, everybody is opening along the same guidelines. We are coordinated. Thank you.
I truly believe that question was meant for the Minister of State Education, not with regards to the national response on education. Well, you see, this is what happens when you have federating units. The center would develop a policy, but when it comes to implementation, the federating units should be given the opportunity, considering their peculiar circumstances, to implement within the context of the framework of the national response. And I believe that's what is happening with the educational sector. And we've always driven that message through, that the subnationals have responsibility for coordinating the national response in their various jurisdictions now. Because we've ceded that to them, we've ceded it to the community leaders, we've ceded it to the religious leaders to effectively deal with that. And I believe they are doing the best they can. We were sharing by the side there. I said, I told Dr. Sani that I think we are in a holiday mood. If we escaped Rachel's questions, then it means that everybody is in a holiday mood today. Looking ahead to the 60th anniversary celebration, I believe we are preparing for that. We've tried to make it as COVID-19 compliant as we can. But in the midst of all this, I'm very, very confident that as a country and as a people, we have responded to the best of our abilities given the prevailing circumstances. The balance was quite difficult when you look at the livelihoods of people and their lives. How do you draw a balance? And it's been quite taxing for even those of you that are reporting. But I believe with what we have seen and the confirmations we have received, even from climes outside our own territory, is that Nigeria is considered as one of the countries that has aggressively dealt with the pandemic in terms of public sensitization, in terms of our response, and in terms of doing the needful. Correspondingly, we might not have received, in terms of risk communication, the perception of the dangers of COVID-19 from our people in the manner that we thought. But by and large, you can say that our national response has been quite effective, and it's very evident even in the areas of what is happening now in terms of our own modest effort in trying to find a solution or to develop a rapid test process for our people. Because definitely as we go into the stage, after the 1 week of dedicated testing that NCDC is putting in place, we need to go aggressively. And the good thing about it is that we are partnering. We are part of the group, the solidarity group that is being anchored by the World Health Organization. And that is why even the 120 million rapid test kits that are likely to be available very, very soon, which will be subjected to validation when they are available here back at home, we would equitably be able to get a portion of it. And we will deploy it, because we need to deploy it to areas, particularly where the molecular laboratories are not available, so that we can have a feel of what is happening out there in the field to help us coordinate our national response. All countries that are dealing with this pandemic in the most effective and efficient way are all responding in that direction. And I believe that some of the policies that we have put in place, as difficult as they looked, but tremendously from the statistics that Dr. Sani has made available this evening, is indicative of the fact that if we had not done those things, we would have been dealing with a serious resurgence of the virus in our country now. We've been able to dampen the numbers, but we believe strongly that if we test more, it might reveal more infections. But by and large, I can say with your support and with your reportage, we've been able to coordinate a national response that has put Nigeria in a very, very good state as a reference point for the African continent, for West Africa, and for other countries that are looking up to us. And what has come out of the Nigerian Institute for Medical Research is quite, heartwarming, that we are not just following and collecting, but we are contributing our own modest effort towards that process. It's a rapid result kit, test kit. I believe that by the time we get all the components and it goes through the validation process, we will have our own homegrown solution. When we started, we spoke about it as if it was a joke. But we can see gradually, with consistent application of funds and knowledge, our research institutions are living up to the expectation. And by the time we drive home and we are able to get our own home solution to COVID-19, we will also go on the scale of times and validation that Nigeria did not only sleep, but we participated in the processes of developing our own ground solution. At this point, I would take the opportunity on behalf of members of the Presidential Task Force and you gentlemen and ladies of the press to, on your behalf, to truly extend the gratitude of the joint team that has coordinated this national response in the last 7 months, to thank Mr. Adekunle, the Permanent Secretary, GSO, as he takes a bow at the end and the close of business tomorrow. Thank you so much for your very generous appreciation of the services he has rendered on the Presidential Task Force. It's been quite drilling. If you understand the complex nature of the Office of the Permanent Secretary, GSO, in the Office of the Secretary to the Government, it's quite demanding because of the role of coordination that that office demands. We deal with the coordination of all government programs, policies, and projects, and the GSO office particularly anchors that. So to combine it with what we've gone through collectively in the last 7 months, and somebody had to balance that official work and this ad hoc responsibility, and has done it in such a remarkably good way to the satisfaction of those of you on the members of the Fourth Rem and those of us that he has served as the task force. I think he deserves our gratitude at this moment. And as he exits the close of business tomorrow, I want to assure you that he will continue to serve in this presidential task force to the conclusion. He will not be serving as Permanent Secretary GSO, but he will be serving as Olusegun Adekunle in a different capacity, because there is need for institutional memory, so that at the end of our exercise, the lifespan of the PTF, by the end of December, as approved by Mr. President, we should be able to document our activities from inception and the milestones that we have achieved and the things that we think we could have done better. Because that was the essence of the midterm review that we had with development partners, with stakeholders, was a critique of what we've been able to achieve and what we can do better and going forward. We would need some institutional memory to be able to codify that and leave it for the purposes of posterity. This will not be the last pandemic. This will not be the last virus. Some others will come. But as a legacy of the service of this presidential task force, we want to leave something on ground. That these were the things we did. We could have done them in a better way. And we believe that if we are confronted with the same environment or the same situation in the future, these are the kind of steps that we want to see those that are coming behind us do. For that reason, you need institutional memory of how we started, how the concept notes were drawn, how all the documentations were done, and the milestones that have been achieved. If in the process we get a vaccine, it should be recorded. How did we get there? Now we have a rapid test kit that is in the process of being validated. How did we get there? Who and who participated? And I believe that records are very, very important going into the future. And for that reason, we'll tap off his experience, retain those experiences, and make sure that at the end of our responsibilities, everything is captured in the best manner. So on behalf of all these men and women, members of the task force and members of the Fourth Rem, we want to thank you for your dedicated service, for your high sense of patriotism, and the efficiency with which you have managed the affairs of the PTF. And as you exit, we wish you the best, and I believe that as you leave the public service, you still have a lot to offer, and as often as possible, we will require you to come back and transfer the skills, the knowledge that you have imbibed in the last 36 years in your service to your fatherland and for the good of our people. Those knowledge should not be lost in the process. It's supposed to be transferred in the processes of mentoring and training of our young ones that are coming into the public service. And on this note, I say, have a wonderful retirement time. Enjoy yourself, rest as much as you can, but keep the flag of what you've been able to establish in terms of your dedication high up there. You have done very well, and we commend you for it. And for those of you that have served also in the process of this last month, let me truly, truly appreciate you, particularly the men and women of the fourth reign. You've done very well. We've not been punctual every time, but at every given moment, you've made yourselves available, and you have transmitted and broadcast all the information that is required to keep our people safe, to make sure that they do the needful to preserve lives and balance it with livelihood. And I have been truly, truly blessed and quite impressed with the level of professionalism that you have demonstrated in the course of the last 7 months. Thank you, and have a good evening.
That brings us to the end of today's national briefing. But before I leave this mic, I just have a few words. I'm indeed humbled by the very kind words I've heard and by the way we have all reacted to the announcement of my departure from the Federal Civil Service and the public service in general at the end of tomorrow. And this is coming from a very grateful citizen to a very kind nation, a nation that provides opportunities for her citizens to grow. Service to the nation has brought me joy, and it has renewed hope. Being part of this historic and heroic response to the pandemic is a rare privilege, and I will never take it for granted. The credit belongs to you all, and I want to thank Mr. President for the opportunity he has given me to serve as a permanent secretary in the Federal Public Service, to the type of guidance and leadership I received from the Secretary to Government of the Federation, who is also the chairman of the PTF, to all members, honorable ministers and other members of the PTF for their friendly disposition, for their guidance, for their support, for their understanding at all times. To my team, my colleagues that I have driven so hard to produce results, the credit goes to you. Members of the press that are seated here, and those who are taking notes from remote locations, I want to thank you. And to all Nigerians that have diligently followed the work of the PTF, we thank you very much. Once again, I want to say your support can never be taken for granted. Keep the flag flying. We'll continue to work together on this. Keep your friends, keep those who support you. And on that score, I have two of my friends of 53 years, Mr. Tajuddin and Mr. Dele Saliu. We've come all the way from 1967. From primary school, we were classmates, and we never left each other for one day. They have been quite supportive, and I want to recognize their impact in my life and in everything I have been able to do. I don't want to get emotional. I just have to thank you very much. And for Nigerians, I've been wearing this mask since we started this campaign. This is my face. My name is Olusegun Adeyemi Adekunle. I thank you very much.